Romanizi wa myaka 5 nafuna omusujja gw'ensiri olubuto lwa myezi 8 ne wiiki 3 ndowooza wali wabulayo ennaku 4 azaalibwe. Omwana ono ne gumukosa ne muzaala nga gumukosezza ku bwongo. Omusujja ogwo gwali gw'amaanyi naye saagutwala nga kintu kikulu kuba nali siina kye neraliikirira nnyo kyamaanyi kye gusobola kuleeta okuleka okwewulira obubi. Era nalowooza nti kaseera katono nnyo gujja kuwona nga bulijjo wenzijja ngulwala ne gukola ki guwona. Naye mba ntuuka mu lunaku olwokusatu mukwano gwange n'aŋŋamba nti anti Doola waligenzeeko mu ddwaliro omusujja ogwo guyinza okujja n'omwana. Wali badde ogendako mu ddwaliro n'olaba abasawo kye bakola ki kye bakugamba. Kati olw'okuba twali mu biseera bya COVID oli omungi nagenda mu kiriniki saagenda mu ddwaliro ddene. Nambuuza wakola sikaani nti ye nansaba ebipapula nali ntambudde nabyo nembimuwa nankeberako embeera nga mwe nali naŋŋamba omanyi omwana ono nasooka nankeberako wano ku lubuto naŋŋamba omutima gw'omwana gukuba nnyo olwaleero alina okukola ki okuva mateekako eccupa y'ebisa saawa ziba ziwera nga 7 ogw'ekiro nga nzaala omwana.
Ng'omaze ozaala omwana ono wategeererawo nti alina omusujja oba kyali tekiri obvious nga balina olindako ennaku balyoke bamanye kiki ekimuluma?
Nzaala omwana engeri oluzaalo gye lwali olusooka saategeera nnyo nti omwana akoze eki afunye obuzibu kuba nze nasindika omwana teyakaaba. Sakyewuunya nnyo nti lwaki omwana takaabye naye nga bba abasawo bakola ki bakitegeera. Ntandika okuwulira nga bali mu ssaala basaba neŋŋamba omwana gwenzadde ate kati ssaala zaaki. Omwana nga bali mu kusaba nga musawo agamba oli musajja w'amaanyi olina okubeera ku nsi. Nempulira nga basaba okusijeenya we namanyira nti omwana alabika afunye obuzibu. Era obudde we bwakya musaawa ne ziwera 12 nampandiikira ebbaluwa nampa omuyambi we ne tugenda neyo ebbaluwa. Era omukyala oyo omusawo yannyamba nnyo kuba eri saabonanyibona nnyo Kawempe. Atuuka n'awaayo buli kimu naleka ng'omwana bamutadde mu nassale nze nesigalawo nga nnyimiridde ye n'agenda nga mmanyi bagenda kukola ku mwana bamale bamumpe enkole ki nzire ewaka. Sikaali kwe kuŋŋamba nti oluno olutalo lozzeeko wano gye batadde omwana ogenda kuvaawo kati genda mu level 6 ofune ekitanda bagenda kutandika kujjanjaba mwana. Awe namanyira nti kati birabika nga bikalubye namanyira nti omwana alabika afunye obuzibu bw'amaanyi. Tubeerayo ndowooza zaali ziwera wiikisi nga tugenda mu wiikisi ey'okusatu nga tuli awo Kawempe. Era olunaku olwaddirira abasawo nga baŋŋamba nti tukoze eki tukusiibudde nga bampandiikira ebbaluwa ensiibula. Naye we bansiibula omwana yajja akaaba mu mmotoka okuva we twava mu ddwaliro paka waka nga tasirika. Nebuuza kiki bugumu mwambudde buli kimu nkitadde wali asigadde bwereere naye ng'omwana takola ki. Olwo nno bwe ntandika okumanya nti omwana ono bingi nga sinnabirowoozaako naye ntandise okumanya nti omwana agenda kuntawaanya. Awo newe natuuka ku muzigo we nali mpangisa ne ŋŋamba kangendeko mu kyalo sijja kusobola mwana atandise okukola bye sitegeera. Abantu abakulu bakole ki bampabuleko. Nze mu kyalo ewaffe jjajja wange atunuulira omwana naye tamutegeera kubanga wano we bamufumita empiso yazimbawo akantu bwe kati. Omwana nga buli wetumukwata wakola ki wamuluma. Bw'omukwata muno mu matama muno mwali muzimbyemu ebintu nga biringa amayinja muno namuno mu mikono muno nga muzimbyemu ebintu biringa amayinja naye ng'alina obulumi nga kasirapu ka Panadaako ke kamuweweeza nga bwe kaggwawo bwe kati temusobola kwebaka. Akutuusa jjajja wange we yaŋŋamba nti omwana muzze mu ddwaliro gye wamuzaalira nange nkoze eki ansobedde. Kansitula mwana nga muzze e Kampala enkeera nga nninnya ŋŋenda e Kawempe. Omusawo yankolako nga ŋŋamba omanyi omwana wo yafuna ekizibu bwe kiti ne bwe kiti. Omusujja ogwakuluma ng'ogenda kumuzaala gwakosa obwongo bw'omwana era buli kintu agenda kukikola mpola. N'aŋŋamba buli kimu ajja kukikola naye buli kimu mpola. N'aŋŋamba era oba obadde olinda okutuulako omwana werabirira bulabirizi mwana, teweeteeka nnyo ku puresha nti kanninda okutuula, kanninda okwavula, kanninda okukola ki. Buli kimu kikole ki kirinde mpola mpola, kuba omwana kati obwongo bwe obukola ebintu ebimu bwafa. N'aŋŋamba era ogenda kutandika wano therapy egenda kuyamba obwongo bw'omwana oyo obwafa, buno obulamu obwasigalawo, okusomesa buli obwafa nti kati nnina okukwata, kati nnina okutuula, kati nnina okulya, kati nnina okukola bwenti. Bwentyo ne ntandika exercise nga wa myezi 5.
That is the story of Doreen. Doreen caught malaria towards her full term of pregnancy, and in turn it affected her child, even though it was not so severe according to her, but inside there was something different happening, and that is a story that we were watching just a few minutes ago. Thank you so much if you're just joining us. It's NTV Medical Matters. I am Viola Sierra, and we are supported by Bill and Melinda Gates Foundation. Now, Richard Idro is an associate professor of pediatrics and child health, and he's in studio with us right now. So we're going to dive in straight, Richard, starting with malaria. What causes malaria? How does it happen? And why is it the leading cause of death in Uganda?
Good morning, Viola, and good morning, viewers of NTV. It's a pleasure that you are with us this morning. Viola, malaria is one of our biggest problems in this country. When you look at malaria worldwide, we are one of the most affected countries in the world. Every year, we have between 12 million and 16 million cases of malaria. And currently, we are between the 3rd and the 5th most affected country in the world, not just in Africa. And in terms of the effects of malaria, lives lost, we are number 5. So as a country, we are one of the most burdened countries affected by malaria. What is malaria? In many of our communities, we really all know what we call anybody who develops a fever, we say this person has malaria. But specifically, malaria is an illness caused by a parasite, which is quite common in Uganda. Most of our regions in Uganda have a very high prevalence of this parasite, except maybe in the highland areas of Kabale, where the prevalence is lower, and now also with some interventions around Kampala, things have reduced a bit. But otherwise, the whole country is affected, and actually, some of our regions, especially around the northern shores of Lake Kyoga, Lango, in Apache, in Oyam, have the highest transmission of malaria in the world.
What is the cause of that?
What is that? That the number of times a person gets bitten by a mosquito which is infected with a malaria parasite in one night is highest in Uganda and in that part of the country. So malaria is a parasite. In Uganda, unfortunately, we have the parasites we have the most aggressive form. We call it Plasmodium falciparum, and it is transmitted by the bite of a female mosquito, a specific type of mosquito called Anopheles mosquito. We have plenty of them here. These mosquitoes are adapted so nicely. They tend to wait when you are deep asleep, So they bite most somewhere between 11 p.m. and 3 p.m. Sorry, at 3 a.m. 11 p.m. and 3 a.m. when you have you have fallen really nicely asleep, you're unlikely to hit it, and so that it successfully bites you. And the reason they come and bite us is the female mosquitoes need blood for their eggs to develop.
Okay.
So they come, bite, but to make the blood not clot, they inject part of their saliva through the tube, their biting tube, so that the blood does not clot and they can suck it freely. And in the process of it, passing that or injecting that saliva, they pass the malaria parasites. So the malaria parasites enter your body, and they are quickly taken up in the liver, and they start developing in the liver. And once they have matured a bit, they burst open these liver cells, and then they are released in the blood. And once in the blood cells, in the blood, they enter the red blood cells. The red blood cells are the ones which carry oxygen around our body, and again grow there. And as soon as they mature, multiply, they burst it open, and then invade new ones. Okay. And so quickly, the following things happen. So every time they release, many red blood cells burst, because it tends to occur together at the same time, together. You release these foreign particles in your blood, and it raises the temperature. So your body's temperature rises. And because they are bursting out down your red blood cells, quickly you start becoming anemic. And inside the red blood cells, we have the pigment which makes the red blood cells become red. It's called hemoglobin. And that hemoglobin is broken down, and usually we pass it in urine or in stool. It gives the yellowish color of urine and the brownish color of stool. But because the parasites are breaking it down, breaking the red blood cells down rapidly, the liver does not have enough time or capacity to process it. So it starts accumulating in the body. So you see a person's eyes becoming yellow. You are losing blood. You have a high temperature, or you have fever. Then you start feeling weak, and progressively the person becomes weaker and weaker, starts vomiting. Young children may develop diarrhea. You have headache. You have joint pains.
What is the duration between the time that the mosquito injects you with that and when all of that process happens?
So it usually, from the time you get the bite to when you start developing these symptoms, it takes 9 to 16 days.
Oh.
So you may travel to say the village, and then a week and a half later is when you start developing those symptoms. Because at first you do not realize. Remember, when the mosquito injects the initial the larval forms, it enters the liver, they grow there, then they burst the liver cells open, then they come into the blood, enter the red blood cells, and mature. And it is now when it starts bursting open the red blood cells and invading new ones. That is when you start developing, when you start experiencing the symptoms. Now, the most affected people are usually young children, and like in this video, pregnant ladies, the first, especially the first pregnancy and the second one.
Why is that?
Because so let me start with the one of children.
Okay.
All germs in the body, any germ entering our body has a capacity to develop a response to kill this germ. So we have a defense mechanism, which is our immune system. So the body will generate, some cells will come up, will release antibodies, which attack these germs and destroy it. But the body usually has to know this thing. So should have experienced it before. And if you have not experienced it before, you will be like a Mzungu coming here in our country, has not known malaria, and so even very few malaria parasites in the body will just throw you down. Now, the one of pregnancy is different. So when these parasites, after the red blood cells, they tend to they are very efficient. They try to evade the body's immune system. They enter places like in the brain. They go and attach there. They don't move. They go and enter the lungs, the kidneys, the intestines, and attach there. So that as they move in the blood, these antibodies do not find them, or the cells do not find them. Now, in a pregnant lady, there is a new site. And that new site is the placenta. So they quickly enter there. That place has a lot of oxygen and a lot of food for the baby. And so they grow very quickly, and they go and attach there. So at the junction between the womb and the placenta, they go and fit themselves there. Unfortunately, what they do is that now they literally start cutting off oxygen and glucose and other foods to the baby. And so the baby may be aborted, or you have a premature delivery, like has occurred in this child of Doreen. Was it Doreen? Yes, like this baby, and it can go right even to the brain and affect the baby. So the baby was born, the mother had a fever, it had cut off the supply of nutrients, oxygen to the baby, and the resulting thing is you may have a premature delivery, or you give birth to a very tiny, small baby because the baby was not able to grow well, or you'd have a premature delivery, or some babies even die in the womb.
I'm curious, when such a thing happens, is there any possible way to reverse that or to flush out the malaria from getting to the child?
No, the only ways to treat is really an urgent, is starting the treatment urgently. So in effect, in all these cases, and malaria progresses so rapidly from the time you develop a fever, in the next 24 to 48 hours, and especially in children and in pregnant women like that, you start developing the severe forms. Now, the severe forms is a complication of malaria. Now, many of us who have experienced malaria, people just don't take it. I've had malaria so many times. But if it got a child now, a little child now who has not developed this immunity, or a pregnant woman who has not had, especially the first pregnancy and the second one, these severe forms develop really rapidly. But also, if you have not had it for many years, 4 years, 6 years, you will have lost part of
the immunity.
That immunity. So even you yourself, you become at risk of developing these events. So what are some of these complications? I had already mentioned that one, it is breaking down your red blood cells, so you become anemic, and it's one of the most common reasons why we give blood transfusion in hospital. It may clog the lungs, but also because your body is working so fast, you need so much energy, yet you are not eating very well, you feel like vomiting, or you are vomiting, your appetite is poor. So many of these children develop problems with breathing. So may be challenges with breathing. The others, because it goes and attaches in the deep blood vessels in the brain, and this is where trouble starts. Or the kidneys. So increasingly we are seeing people, it is damaging people's kidneys, and they are ending up with kidney failure, or in the brain. And when it attaches a lot in the brain, they develop convulsions, and then they go into coma.
Is this a new development, or has it always been this way?
It has been there. It has been there. And in fact, this is now deadly. Chances of death are between, if you develop such coma, your chances of death, even with treatment. Without treatment, 100% the child will die. But with treatment, good treatment, between 10 and 20% will still die. And then of those who survive, brain damage like this occurs again in another almost 25%. A quarter of the survivors will have trouble.
How does it present in adults, especially for someone that has had it before, but then they end up having like a very severe case that most likely takes their life? So
in most common in adults, if they have had malaria several times, the malaria parasite in terms of germs, you see we have so many germs, viruses, bacteria, and then parasites, fungi. When we look at germs in general, they are big organisms if we compare with other germs like viruses. So for viruses, for example, we have vaccination, it can target the whole virus. But usually in immunization, that is how the body fights things. For malaria parasites, it is targeting a very small area. So you require several attacks for your body to develop immunity, but then immunity is not complete. It is actually partial. So what it does is that you get mostly uncomplicated malaria. It will be fever, headache, body aches, you feel horrible, you do not have energy, you are unable to go and work, or you work but with trouble, with difficulties. And if you take long, again, it grows in your blood, then actually the chances of developing the same severe complications is higher. Or if you have not had the attack for a long time, for example, now many of us initially were born in the villages, now we moved to Kampala, the control measures have improved, we are living in slightly better houses, so malaria in Kampala has gone down. Now around Christmas, you take a ride, you go to the village, and you forget to use your bed nets. You get the attack. You come back January around 15th, 10th there, it's going to get you. And if you have not had it for a long time, chances of you getting a very severe one, of throwing you down for a week or so, is very high. And if you don't get treatment, it will kill you.
So why do you think that it's very common for most of us to ignore these signs and symptoms?
Because people think, malaria, I've ever had it so many times. It is. Yes, and it's actually causing us problems. It's causing us problems, this thing, because of the attitude we have. And in fact, we have so many of these children now. We have so many schools in Kampala, Wakiso, Mukono. You can imagine this migration, they are coming. And actually, again, the number of cases here started going up because of this. During holidays, they move, and then they're coming back. But especially for ladies with a pregnancy, you can never afford malaria. It will kill your baby, or you give birth to a very tiny baby, or the baby can have problems like this. It can abort it, you can have a premature delivery, the complications are numerous. But then for the other young children, those severe malaria, which I say tends to develop between 24 and 48 hours, there are so many things which can go wrong. I had mentioned that you become anemic, or you may develop cerebral malaria, or you get multiple convulsions, or you get problems with breathing, you can get kidney problems. Some children, they may get bleeding problems. Actually, you start bleeding. Or I had mentioned that the eyes can become very yellow. You have problems with the liver because the liver is not working well. There are really multiple things. Or some children, they get repeated, the blood sugar keeps on falling down, and having very low blood sugar is dangerous for the brain. It will damage your brain. It's a low.
It's actually trying to shut down the entire body. I'm quite surprised.
Yeah, actually, that's what it does.
Yes.
It's multi-organ failure.
I like that you brought up cerebral malaria. So we're going to take a break right now, dear viewers. And when we return, we shall be talking about cerebral malaria. Please do not miss, especially among us children. And for you who's pregnant, your child could be at risk. So please stay with us. We'll return. mwakomawo ewaka olabako improvement ki nga mukola therapy?
Improvement gye ndabawo essaawa zino tuula kati alinga agezaagezaako akatonotono wadde ng'era akyalemeddwa naye kale okusinziira luli nti bwe namutuuzanga yayiikanga buyisi bw'ati naye kati agezaako okuba nga asimbamu emikono n'abanga atuulatuulamu n'obulamu bwe laba nti bweyagaza kuba talwalalwala alya bulungi kale tantawaanya ekintu ekiringa ekintawaanya kwona omwana mizoozi atera omusumbuwasumbuwa naye bino nti musujja yeesise biki atera kulwalalwala.
Nga twogedde ku mmere, omwana omuwa mmere ki? Nalabyeko omwana omulala balya mmere ng'efaanagana oba ono alina special food gy'omuwa nga yemuyambako okubeera better?
Emmere era eyawuka kubanga kati ono tasobola gaaya bikaluba. Ayagala emmere ng'egonda, ayagala akammonde ng'ako, ate nako kukalya kalina okuba fresh okajja wali ku kyoto okasotterawo n'omuweerawo kuba bwe kakaluba aba takyasobola. Era ne bw'aba agaaye wawuliramu buli genda okulaba abukomezaawo ku lulimi ayagala nga kaseerera. Ne bwe liba ttooke lirina okuba nga ligonda.
Nga ng'oggyeko physiotherapy n'emmere gy'omuwa waliwo bintu biki ebirala by'omukolera omwana ono ng'ogezaako nga abeere better mweno condition gy'alimu?
Eyayo ono yanjawulo okusinziira ku mwana oli omulamu. Kubanga ono olina okumuliisa buli lunaku ate olina okufuba okulaba nga buli w'omuliisizza kuse si kumuwaako bw'oba tolina budde bwa muliisa oba kisingako n'otamuweera ddala kuba yeetaaga essaawa nga nnamba omuliisa okukkuta emmere kuba alya mpola si waakukaka wayagalira wayasamira okumuteekayo emmere. Pampa waakukyusa buli kadde. Ebyokulya ebibye biba byanjawulo ku by'oli. Kye nnyinza okwogera ku musujja gw'ensiri mu bakyala b'embuto abakyala kasita awuliramu nti olusujja luzze naddala nga essaawa esembayo nti lubuto luli myezi 8 ne wiiki emu ako akaseera kaba kabi nnyo kwanguwa kuddukirawo mu ddwaliro kubanga nze nagayaalamu nalowooza nti nja kuwona n'engeri gye nnali siina sayini yonna yakuzaala nalowooza nti nja kuwona nti omukyala w'olubuto waaba afunye omusujja alina okwanguwa naddukirawo mu ddwaliro abasawo ne bamubuulira ekiddako.
Kati nga tuwumbawumba waliwo ekibuuzo kyewandyagadde omusawo bwe tugenda abeera naye mu studio akunnyonnyole?
Ekibuuzo kye njagala okubuuza abasawo, omwana ono kati nga bwe yakosebwa omusujja gw'ensiri awo nga yakazaalibwawo tewali kyamaanyi tewali bujjanjabi bwonna bwe basobola kumuwa n'atakosebwa nnyo okutuuka ku kino kubanga baŋŋambako nti bw'aba yakazaalibwa waliwo kye basobola okukola ne bakola ki omwana ono omusujja ne gutakola ki ne guba nga tegumuafekitinga nnyo naye ate nze ku wange saakikola ki saakiraba kubanga n'omwana ndowooza nze muli ndowooza nti bampa omwana nga tannaba nakubeera mbeera nnungi ne bansiibula namulaba nga bansiibudde naye ng'omwana tali mu mbeera nnungi.
That is Doreen, a mother of that little boy. She's narrating her story of how she caught malaria towards the end of her pregnancy, around 8.5 months, and it affected her child so badly. That's what you've been seeing on screen, and we welcome you if you're just joining us. But also in studio we have Dr. Richard Idro, who is an associate professor of pediatrics and child health. And so, Doctor, we shall be picking up from Doreen's last remarks about question to the doctor. Is there anything that could have been done at birth that could have reversed this situation, the condition the child got?
Maybe let me go back to the first principle. Her child's issue is not exactly cerebral malaria.
Okay.
Her child's issue was malaria during pregnancy. So what led to the premature delivery was the infection mom had. And as I had explained earlier, the parasites invade the placenta, the placental bed, cut off oxygen, cut off nutrients, and in the process, initiate the early delivery. But by cutting off these nutrients already, it is affecting the brain. Then you give birth to a premature baby. Prematurity has its own complications. And also, the baby also contracted malaria, which also had additional issues. And by the time the baby was born, the baby had trouble with even breathing. So birth asphyxia, you don't have enough oxygen. Already all those things have compounded in damaging the brain. So what could have been prevented in the first place is malaria infection during pregnancy. And those are and a lot of these interventions are offered during the antenatal clinics, where mothers are given the generic name is we say sulfadoxine pyrimethamine. It's an antimalarial which is given monthly, which is given to the mothers, and they take. But also they are encouraged to use bed nets so that they don't get or contract malaria, because that is the real essence of the thing. No pregnant ladies will contract malaria. And in any case, anybody, really nobody will contract malaria, because malaria is just bad. Now, coming to so at birth, I think they did a lot of things really to the best of their ability, putting the child on oxygen, giving the child flu, trying to resuscitate the child because the child was not breathing very well. If I got the story well, so attempting to resuscitate the child, but already there had been some significant. My suspicion is that there was significant injury to the brain by the time the child was born, and this continued after birth. Now, as to whether you can reverse that injury, the injury to the brain, there is not much which you can do. If a brain cell dies, that you can revive it. But the therapies the child has been going through is what we often actually do to try to restore some function. And so let me come to the other side of cerebral malaria. I had already described that within a few hours of being released, these parasites in the blood, some of the body starts releasing its own fighters to try to kill these parasites. So the parasites go and hide in the deep blood vessels, and especially in the brain or kidneys and lungs. And in the brain, if the numbers are high, these children develop convulsions. So we hear a child has gotten a fever and then develops convulsions. And these convulsions can be multiple, or some of them may be prolonged. You may have convulsions for 30 minutes, and those convulsions in them can actually kill the child. Or the blood glucose drops, is not fitting. The low blood sugar also can induce convulsions. Some of the children get convulsions because of the very high fever. And with the convulsions, the child goes into coma, so it's unconscious. And so cerebral malaria, for us in the hospital, for definition, we say is a child who presents in a coma. You failed to arouse this child. Even if you corrected the blood glucose, it does not wake up. And the child has a positive malaria slide. And many times, these complications develop within 48 hours of the fever. So generally, we tell the population, and I'm telling really the public, no child with a fever. So the sun will not set twice on any child with a fever before the child receives a correct diagnosis and be initiated on treatment. Otherwise, these complications develop. And once these complications develop, it is a race against time to save life. And even then, we lose some children. Some of them die. And of those who do not die, we actually get some of these complications. What are some of these complications? Some children lose vision. Actually, they become blind. Others, they develop paralysis, like this child, so motor function. Some children have developed speech problems. We have a lot of speech problems. Others develop epilepsy. Like cerebral malaria, 10% of the children who recover will develop epilepsy in time. Between 10 and 15% will develop a speech problem. Another 10%, 5 to 10% will develop a motor problem. They may have a paralyzed arm, a paralyzed leg, but more importantly, some of them are developing behavior problems. So they are disruptive, they're hyperactive. Even if they sit here, they start jumping all over the place. They disrupt so many things. Many of them develop learning problems. So even when they go to school in future, they have issues with learning. Some of them may not, even if they cross, some of them may not cross P7. They may fail to pass.
Some of those signs sound like autism. Is there any connection?
There are some autistic features which we have observed. We have actually spent quite some time studying the long-term effects of malaria. So autism is a disorder of communication. So the perception, the child's understanding of how words are communicated or speaking are defective. And actually there are some autistic traits. Some of the children go towards that because it is a spectrum of things.
Yes.
Yes, there are some traits which tend to fit along autism, but usually a lot of it is hyperactivity.
Okay.
They're impulsive, they're hyperactive, they're disruptive.
Thank you, Doctor. We shall be opening up phone lines later, so be informed and call in, give us your questions, the pressing questions about malaria, cerebral malaria, a lot of things surrounding malaria. So feel free to call in later on. The phone, the lines are on your screen, the numbers, you'll be able to call us. But also let's continue with who is most at risk. You know, what are the risk factors? Who's most in danger of getting cerebral malaria?
So the biggest risks for us, we live in an area where the mosquitoes breed literally easily. We have lots of water bodies. We have a lot of rainfall. We have the right temperature in Uganda. Yes. Yeah. So actually the mosquito multiplies so rapidly, and that is why in the areas are in Teso and Lango and Acholi, and then West Nile is really incredible. And then in Karamoja during the short rain periods, it grows so fast. Then coming down to Tororo, Bukede and Busoga. So all these areas is intense transmission. So one, we have the environment. That is the right environment. But then two, it is the things which we can do around our homes. And so if we allow this environment to be around our home, of course, the risk is much higher. But the most affected people, as I've said, are the young children under 5s, and then above, and then pregnant ladies. But I had already mentioned that, like in the urban areas, now we have children who grew up earlier without exposure to malaria.
Yes.
So increasingly, we are starting to see the older children in P2, P3, P4, 5, 6, starting to get, especially the ones in urban areas, because they did not experience it during childhood. And so we go to the villages, and when they get, and some of them fall really ill. In the past few, I'll say last year and this year, we have lost several big children in secondary school.
Did you say that cerebral malaria is unreversible? When the child catches malaria, run to the hospital, but what if they find it's already at that stage? What happens then?
It's so long as it started on treatment, you may reverse it, but in some cases, some children will still die. If the child has already developed fever, is already unconscious, the risk of death is between 10 and 20% of the children will die.
Okay.
Even with treatment. But without treatment, 100%.
That's very terrible news. So we have some callers, and we are going to take about 3, and then we shall pick up from there. So, NTV Medical Matters. Yes, please. What's your name and your question?
James from Kayunga.
Okay.
I've just tuned in on your program on NTV.
Yes, please.
Yeah, I have a daughter of 10 years. Hello?
Yes, I can hear you. Go ahead.
Yes, this daughter of mine was attacked by malaria, but which was, I think, poorly managed. That was after 3 days. But then when I took her to the dispensary, I think the malaria was mismanaged, and she began shaking. It is now coming to about 6 months. The serious shaking reduced, and now when the arms were shaking terribly, only the arms, both of them. So today, the shaking is now reducing, but now she has the tremor, muscle tremors. What can I do? Because the doctor there told me she was almost developing cerebral malaria. Thank you.
Thank you too. You had that question, doctor, so we shall be answering them all at once. If there is actually someone else coming through, I didn't understand that there could actually be the shaking. I thought paralysis most likely, but then the shaking is a different one now. So I think we shall be having another caller if they are ready. So let's have another caller. NTV Medical Matters, your name and where and your question.
Hello, this is Diana calling again. How are you doing?
Yes, please.
Now, is it possible to give birth to a baby who is named when they had malaria when they were still pregnant?
You got that?
Is it possible to give birth to
a baby?
Yes.
A baby that is lame. I think it was a baby that is lame.
Lame.
So we shall be having one last call, and then we shall get into all of them. So NTV Medical Matters, your name and your question.
Yes, thank you.
Please speak up. We cannot hear you.
Thank you so much, and thank you for the program. Thank you so much, sir.
Okay.
My name is Paul. Yes, so my question is, is there a chance of, that child to be presented on the show?
The network is breaking, actually. We cannot speak that question clearly. We will have to have another caller. We couldn't get that. Yes. So we have a final caller, NTV Medical Matters. Your name and your question.
Yeah, please, what I can add on is to remind the doctor, some people when they first start when they start saying, please let doctor emphasize on it. Please.
Please repeat that. Could you please repeat that? Then you're really breaking. We can't get the question.
I was telling the doctor. Hello?
Yes, we can get you. Go ahead.
Yes, I was telling the doctor to advise some people who believe when they first start children, they use witchcraft. You know, African, we still have that mindset. Some people, they give birth to children and they start saying it's witchcraft. Please let the doctor advise the way and
all right, thank you so much. Thank you so much for your question and for tuning in. So, doctor, you had all those, it's a variety.
Yes, yeah. So starting with the first question about shaking, and you'll actually have noticed that, and Mom Doreen mentioned that her child even had problems with shaking, and that sometimes the muscle will be like some hard things. So there's a part of the brain which controls other than the movement, it regulates the strength of the movement.
Okay.
And sometimes even when that part is damaged, you can actually have tremors. So, and then there are other tremors which are it may be affecting on one side, it may be a seizure, a form of a convulsion. So yes, cerebral malaria can actually do that. And he mentioned, I don't know whether he's in Kayunga.
Yes, please.
Yes. If he could go to Kayunga Hospital, there are pediatricians there, they can assess this girl. Because there may also be another thing which may be responsible for it. But there are at least some 2 pediatricians there. I know they should be able to assess this child and help. Some of the tremors, we may have some medications to control it. Okay. And then about the baby giving birth to a lame baby, we have had this story. Yes. Malaria can cause strokes while the baby is in the womb. It can induce a stroke, so you can have a baby who is born with paralysis on one side, or this kind of damage which is extensive. And so yes, it can do it, but also you may give birth to a normal baby. Yes, or it may be unfortunate, it may be aborted or may die, but the normal ones are also there, or with the degree of impairment. And I'll come lastly to the one about the advice about people saying witchcraft, because I thought we should really emphasize the prevention of malaria. Malaria is real. In Uganda, we have one of the highest burdens of malaria in the world. We are one of the most affected countries. We have about 15 million cases of malaria every year. You can imagine the amount of money we spend on treating malaria. But in the process, it's not just the treatment, the money spent on the treatment. The death it is causing of mothers, of babies, or the number of days lost to school. If you fall sick, 3-4 days, you're out. The mother is also not working, or the father is not working, taking you to, and then the transport you are spending, the amount of money you are spending. We, as a country, we should really do everything to prevent. The Ministry of Health has really done part of its job by delivering mosquito nets throughout the country. It has gone several rounds now. The education which we are having, like NTV, I want to thank NTV for this initiative. We are addressing a real problem in this country.
Before we can run out of our time, Doctor,
yes, yeah.
Let's quickly speak about the stereotypes, the myths, these crazy beliefs about witchcraft, my child was bewitched.
Yes, I'm coming actually to that. And in 1 minute, I can do it. And then about
the vaccines as well, the myths about the vaccine, now that we have it.
Yes. So the parasite is there. It causes the real illness, and we should deal with the parasites. And actually, as mothers and fathers, we know this. Often the challenge is now when, like, for example, this mother has accepted the difficulty of things which have happened, but in the community, people talk in your ears. They say, such and such a neighbor is the one who is bewitching you. But the reality is the disease has occurred. The germs can be seen under a microscope. We can test it. It's real. Let's really address this challenge, and because in a home where it is really well managed, the home is clean, we do not allow the mosquito to grow, we are emptying, clearing, filling off holes, the risk of malaria is much less. And as if we took that responsibility and took charge of our homes, we can prevent it. And then we make people sleep in the nets. And the next thing is, for the children who have been treated for malaria, we now have another intervention. Once they are being discharged and they are going home, we actually give some medicines which they take monthly for the next 3 or 4 months. And the idea is these medicines will protect these children from developing another episodes of severe malaria. Because if they get it, it can kill them. So we call it malaria chemoprevention. And then lastly, we now have the malaria vaccine.
Yeah, in about
yes,
less than a minute.
Yes, and the malaria vaccine is being given to children under the age of 1 year, actually up to 11 months, six months. The children receive it at 6 months, 7, 8, and then a booster or 1 year later. This vaccine has been tested, and as a pediatrician who has been practicing medicine, now I've been a doctor for about 30 years. Yeah. I would like parents to have the confidence that this vaccine is safe.
Thank you so much, Doctor.
I'm
actually being chased out of this studio, but it's really been a pleasure having you. Thank you so much for spending time with us to talk about malaria and cerebral malaria. And thank you so much, dear viewer, for tuning in. We have quickly run out of time, but we hope to see you next Monday on NTV Medical Matters discussing another health matter. It's always a pleasure having you. I'm Viola Sasha. Have a lovely day.